The main takeaway message of this article is that advanced hepatic fibrosis occurs in about 8% of women and 25% of men with hemochromatosis. And there are a number of known risk factors already for this, including the severity and duration of iron overload, serum ferritin values over 1,000 microgram per litre, liver iron concentration greater than 200 micromole per gram, and mobilizable iron stores of greater than 9.6 grams. So my name's Professor John Olenek. I'm based at the Fiona Stanley Hospital in Murdoch, Western Australia. And together with my colleague, Professor Grant Ram at the Queensland Institute of Medical Research, we were senior authors on the publication entitled Arthritis Prediction of Advanced Hepatic Fibrosis in HFE Hemochromatosis, which will appear in the September edition of the Mayo Clinic Proceedings. Given the importance of advanced hepatic fibrosis and arthritis in hemochromatosis on clinical outcomes and quality of life, we were very keen to see whether either of these parameters predicted the presence of the other and whether they might be clinically useful in predicting outcomes or disease in patients. What we found was that arthritis was strongly associated with advanced liver fibrosis. In fact, 84% of subjects who had advanced hepatic fibrosis had arthritis. A third of the subjects who had arthritis and hemochromatosis had advanced hepatic fibrosis. And importantly, if arthritis was absent in subjects with hemochromatosis, there was less than a 5% chance that there would be any significant liver injury found. Thus, arthritis has a negative predictive value of 95% for advanced liver fibrosis if it's absent. So what we did to determine these results was we undertook a retrospective cross-sectional analysis of 112 well-characterized hemochromatosis subjects who had liver biopsy-validated fibrosis, and we had complete clinical, biochemical, hematological, and non-invasive biomarker parameters for these patients. The biomarkers that we studied were biomarkers of fibrosis and included the AST platelet ratio index, commonly known as the APRI, and the FIB4 index. We used cutoff values of Scheuer grade F3 to F4 in liver biopsy to determine advanced hepatic fibrosis. And we used an APRI cutoff of greater than 0.44 and a FIB4 cutoff of 1.1 as threshold values for advanced hepatic fibrosis. Our study showed that we had 76 males and 36 females of similar age. 19 of the total cohort had advanced hepatic fibrosis, and 47 in the total cohort had hemochromatosis arthritis. We saw that arthritis was significantly associated with the presence of advanced hepatic fibrosis as determined by biopsy, with a sensitivity of 84%, a relative risk of 7.4, that meaning that if you had arthritis and hemochromatosis, you were 7.4 times more likely to have advanced hepatic fibrosis than someone who didn't have arthritis, and the negative predictive value was 95%. So what does this mean for clinical practice? What we can say is that advanced hepatic fibrosis strongly associates with arthritis in hemochromatosis, and that absence of arthritis predicts a very low likelihood of advanced hepatic fibrosis, supporting its use as a clinical marker for advanced hepatic fibrosis in HFE hemochromatosis. So what does this translate to for patients? What we can say is that we'd strongly recommend that all subjects with hemochromatosis who present with arthritis are evaluated for the presence of advanced hepatic fibrosis. Patients who have hemochromatosis and who don't have arthritis have a very low likelihood of advanced hepatic fibrosis. And the importance of this is that the presence of advanced hepatic fibrosis predicts the risk of cirrhosis, liver cancer, and subsequent morbidity and mortality. So if it's absent, the risks to the individual from a liver perspective are very low. If we combine that with the newly developed non-invasive tests for advanced liver fibrosis, the blood biomarkers, and in particular APRI or FIB4, we can now say that patients with hemochromatosis who don't have arthritis, who have ferritin values of less than 1,000 microgram per litre, an APRI under 0.44 or a FIB4 of less than 1.1 can be reassured that they don't have significant liver disease and don't need further invasive investigations, and can simply move from that point straight through to phlebotomy therapy, simplifying treatment for individuals. In terms of where we're heading next, our research will be built into forthcoming recommendations for routine clinical care of individuals with hemochromatosis. And these guidelines will also be promulgated through the consumer groups that provide support and information for subjects who have hereditary hemochromatosis. Thank you for your attention.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.